This video will demonstrate the upper anterior ribs, or specifically the PA projection of the ribs. Then the second one will be the AP oblique projection, or the AP oblique position, or the RPO projection, which is the right posterior oblique position. So first is we're going to demonstrate the PA projection of the ribs, the upper anterior of the rib. So in patient positioning, position the patient upright or prone. So it's either the two. Then in part positioning, center the mid-sagittal plane to the grid with chin elevated and eyes straight ahead. So this is the PA, so this is the posterior and the anterior. Then, next is place top of the IR or image receptor approximately 1.5 inches or 3.8 centimeter above the shoulders. The next is have the patient roll shoulders forward and rest back of the hands on hips. So back of the hands, forward. Next one is always remember that we need to shield the gonads of the patient because these are one of the most sensitive part of the patient's organ. Next one is the respiration. Before exposing the patient, make sure that you instruct the patient to suspend his or her breathing. It's either full inspiration to depress the diaphragm. The next one is the SID that we're going to use is 72 inches or 72 inches. Okay. The central ray must be perpendicular to the center of the IR. Must be center of the IR. This faces the central ray at the level of the thoracic 7, which is you can palpate it or you can locate it by having the external landmarks, which is the inferior angle of the scapula. The next one is the collimation. So the first is the cassette that we're going to use is 40 by 17 inches or 35 by 43 centimeter. Then in collimation, collimate the collimator or adjust the collimation to 14 by 17 inches. And the KBP that we'll use is 80. Then make sure that okay, perfect. Then in evaluation criteria of the PA ribs is if the patient, if you image the patient or expose the patient above the diaphragm, the ribs from 1 to 10 should be visualized, and below the diaphragm, the ribs must be 10 to 12 must be visualized. So in patient positioning, there should be no rotation. Then lateral rib margins equal distance from vertebral column. Then in exposure, no motion or sharp bony margins. Contrast intensity appropriate to visualize the ribs 1 to 10 above the diaphragm and 10 to 12 for the minimum below the diaphragm. Then the next position is the right posterior oblique position. So in patient positioning, the patient must position it's either upright or supine. Then in part positioning, rotate the patient's body 45 degrees with the affected side towards the eye line. Since we're going to right posterior, right. This is the right posterior oblique position. Then, center a plane midway between the big sagittal plane and the lateral surface of the body. So you need to center the patient's body at the center of the IR. Then position the arms clear and thorax, which is the center top of the IR is have a 1.5 inches or 3.8 centimeter above above. Then relax the shoulder for above the diaphragm and with lower edge of the IR near level of the iliac crest or below the diaphragm. Then always remember to shield the lungs of the patient. Then in respiration, if above diaphragm, suspended full inspiration. Then if below the diaphragm, then suspended full expiration. Then the central ray must be perpendicular to the center of the IR. Then the collimation must be adjusted to 14 by 17 inches or 35 by 43 centimeter and place the side of the marker in the collimated exposure field. Then the SID that we're going to use is 72 inches. Then the cassette that we're going to use is 14 by 17 inches. So collimate, don't move. Center at the central ray must be, make sure that the central ray must be perpendicular to the center of the IR. That's one, then that would be. And the Cartesian evaluation for our right posterior oblique is in anatomy, the radiograph or the anatomy itself must be visualized, wherein the right axillary ribs must be elongated. Then the ribs must be 1 to 9. It's either 1 to 9 seen above diaphragm, and ribs 10 to 12 seen below the diaphragm are the minimum. Then the axillary portion of the ribs projected without superimposition, so there should be no superimposition between the related anatomy. Then the position must be 45 degrees oblique, should visualize axillary ribs in profile with spine shifted away from area of interest. Exposure, there should be no motion. Then sharp banded margins, then optimal contrast and density must be visualized. Then the ribs and the lungs and heart shadow for above the diaphragm and true dense abdominal organs for below the diaphragm should be clearly demonstrated or visualized. I think that would be all.